Welcome to MOH Essentials, Risks and Contraindications of Compression Treatment. These recommendations are based on recent guidelines and our consensus document on contraindications for compression. There are a number of side effects and adverse events are reported in the literature. The most common is skin irritation and discomfort. All the others are very rare, like allergic skin reaction, forefoot edema, bacterial and fungal infection, soft tissue damage or necrosis, nerve damage or arterial impairment, venous thromboembolism or cardiac decompensation. In most of these cases, these were just individual reports, and most of them were based on incorrect use of compression treatment. A lot of concern consists about peripheral arterial conclusive disease and compression treatment. We recommend that severe arterial occlusive disease with a systolic ankle pressure below 60 mm Hg, a toe pressure below 30 mm Hg is a contraindication against compression therapy with compression stockings. We also recommend checking the arterial circulation status before any kind of compression therapy is initiated. If foot pulse or ankle pulse is weak or not palpable, ABPI should be measured and calculated prior to initiating compression treatment. However, edema may develop after leg vein harvesting in bypass surgery or even after arterial bypass surgery or stenting. We recommend that after bypass surgery with improved peripheral arterial pressures, compression stocking treatment may be performed if there is no direct compression effect on the bypass itself. Another concern is cardiac insufficiency in patients who need compression treatment. Cardiac insufficiency in itself does not constitute an absolute contraindication for compression therapy, but we recommend against applying compression in severe cases of cardiac insufficiency in NYHA 4 stage. We also suggest against routinely applying compression stockings in NYHA 3 diseases. When needed, careful use of compression therapy in this patient group may be considered if there is a strict indication with clinical and hemodynamic monitoring. Edema may develop in patients with heart failure. In patients with compensated heart failure, NYHA 1 and 2, and venous or lymphatic edema, mild compression should start in the lower legs before it may be extended to the thigh region. Edema may also be present in patients with diabetes mellitus. The efficacy and safety of mild compression with diabetic socks, 18 to 25 mm Hg in the ankle region, in patients with diabetes and mild to moderate lower extremity edema were demonstrated in a pilot study and in an RCT. At the end, we recommend considering the following contraindications for sustained compression with elastic compression material. In patients with severe peripheral arterial occlusive disease with any of the following: ABPI below 0.6, ankle pressure below 30 mm Hg, toe pressure below 30 mm Hg, or transcutaneous oxygen pressure below 20 mm Hg. In patients with suspected compression of an existing epiphyseal arterial bypass, in severe cardiac insufficiency NYHA stage 4, and as a relative contraindication NYHA stage 3, in confirmed allergy to compression material, and in severe diabetic neuropathy with sensory loss or microangiopathy with the risk of skin necrosis, no compression should be performed. In the ESVS guidelines, the same contraindications are recommended. Thank you very much for listening. It was a pleasure to having you here.